Today is November 25th, 2020. The COVID-19 pandemic has been going on for almost a year at this point. The virus was first discovered in late December or early January, around that time frame. That's when the virus was discovered. Late December of last year, December 2019, to early January of 2020 this year. That's around when this virus was first discovered. So it has been around 10 months since that has happened. Actually, at this point, it's around 11 months since then. And during early January, early to middle of January, that's when the virus started spreading a lot in China. But then a month or two later, it started spreading to many other countries around the world. And 8 months later, it's now November, and it is getting really, really bad now, to say the least. It is screwing over many, many countries in the world, especially the United States. The United States, for the past 7 to 8 months, has been the worst country in terms of the number of COVID-19 cases. We've been number one ever since late March or early April when we overtook China. For a while, China was number one in terms of number of cases because that's where the virus originated from. To be exact, it originated from Wuhan, China. But after China did intense lockdown measures, the number of daily cases in the country in China started to plummet soon after those intense lockdown measures were put into place. The lockdown measures were pretty authoritarian. They were really strict, and I believe that they had some sort of tracking system to keep track of where their citizens were going. So it is pretty authoritarian, and I don't think it's anything that other countries should strive to be like, but nonetheless, that did have a pretty substantial impact on lowering the number of daily cases and the number of deaths per day in the country. But after that, a couple months later, in late March and early April, soon after the pandemic started screwing over the United States badly, that is when the United States became number one in terms of the number of cases in total. And soon after that, I believe we also became number one in terms of the number of deaths in total. We're the only country in the world who has surpassed 200,000 deaths, I believe. To be exact, we're at around 260,000 deaths, maybe even reaching 270,000 deaths at this moment. And by the end of this year, we're probably going to reach around 300,000 deaths. So, yeah, the virus is pretty bad. And it's been over 8 months since lockdown measures started being put into place. It's been over 8 months since schools started being shut down. And it's right around early to middle of March when all these measures started being put into place because that's when the number of cases in the country started to skyrocket and completely spiral out of control. But even though it's been 8 months since then, 8 months since March of this year when all that started happening, the virus is still nowhere near being gone yet. It is still here. Not only is it still here, it's worse than ever. Out of all the months throughout this year, November has had the most amount of cases. November is the only month of this year where the number of cases in a day exceeded 200,000. Hell, it's the only month in the year where the number of daily cases reached 150,000. For a while, we were having over 150,000 cases in a day, and then at one point, we even surpassed the 200,000 cases per day mark. And I believe for the last few days, we've had around 170,000 cases per day. It is really bad, and you can start to see the death count as well. The number of deaths per day is getting pretty bad. It's still not quite as bad as it was in the spring. In the spring, New York was having a lot of deaths, and that really contributed to the death count, the daily death count in the spring. So the daily death count in the spring was pretty bad, but we're still nearing that mark. In the spring, it was like 2,500 deaths per day around there, and at this moment in time, we have around 2,000 deaths per day in the country. So even though it's been going on for that many months, even though it's been going on for so long, and we know exactly how to stop the spread of this virus, we are still having severe problems with this virus, and it is worse than ever in this country. And this begs the question, what do we do to stop this? How do we stop this virus from spreading from person to person? Because scientists predict that this winter will be really dark and that many more people will die. They predict that by the end of this year, there could be 300,000 deaths, and by February of next year, February 2021, there could be 400,000 deaths in total in the United States from COVID-19. So, how do we stop this virus from spreading quickly? Well, there's a few things we can do. There's several things that could be done, in fact. By far the best way to stop the spread of this virus before we have a vaccine, because once we have a vaccine, we can easily stop the spread of this virus if a majority of the citizens in this country take the vaccine. If they don't take the vaccine, that's a different problem. I think it's the job of the scientists to make sure that the citizens know that the vaccine's safe and that it has been tested thoroughly. there aren't any major side effects to taking the vaccine, all that sort of stuff. But before the vaccine comes along, by far the best thing that can be done in order to stop the spread of this virus is masks. Masks do a spectacular job of stopping the spread of this virus. There has been so much data to show that masks really help to stop the spread of this virus. Even if you don't look at any of that data, even if you just think about it intuitively, masks cover up your nose and your mouth. When you wear a mask, it goes right over your nose and your mouth. How does this virus spread? Through respiratory particles. Where do respiratory particles come from? Your nose and your mouth. So if you cover up those two areas, the areas that are responsible for spreading those respiratory particles through which COVID-19 can spread, then you're really doing a good job of stopping this virus from spreading because you're covering up the areas of your face that actually spread the virus. Not only does the mask stop you from spreading it to other people, it also makes it so that even if you have the virus, other people are less likely to get it if they wear the mask, because when you cover up your nose and your mouth, you really reduce the risk of you getting the virus because you're covering up the two areas of your mouth that are most likely to get the virus, your nose and your mouth. Generally, people get the virus because one of the virus particles passed through either their nose or their mouth. There is a small chance that you could get it from passing through your eyes, but that is pretty unlikely, and that is why scientists don't recommend in general that you need to wear any sort of goggles. When you're working in the medical field and you're treating patients who have this virus, then yeah, it's recommended that you wear goggles, but for your everyday life, you don't really need goggles. A mask is enough. If everyone wore masks, then you wouldn't need to do anything else really. But masks do an amazing job of stopping the spread of this virus. Try this if you have a mask. Wear the mask, light up a candle, try blowing out that candle. If the mask is effective, you should not be able to blow out a candle that you light up. If the mask is not effective, then you'll probably still be able to blow out that candle, but if you're wearing a good mask that actually stops you from spreading the virus to other people, then you should not be able to blow out a candle that you light up. That's a general way to see how good of a mask that you have. But by far, masks are the best way to stop this virus from spreading. If everybody in this country wore a mask whenever possible, I guarantee you we would not be seeing the spike in this country that we are currently seeing. None of the states that are experiencing massive spikes, which at this point is almost every state, let's be honest, they would not be experiencing massive spikes right now if everybody wore a mask whenever possible. Masks do a spectacular job of stopping this virus from spreading. So much data has been there to show that, but masks are the number one way to stop this virus from spreading before we have a vaccine. Once the vaccine comes along, those will be the number one way to stop this virus from spreading, the vaccine, because the vaccine, depending on how effective it is, it can reduce your chances of getting the virus anywhere from 50% to 95%. 95% would be a best case scenario where if you take the vaccine, there's a 95% chance that you're actually immune from getting the virus. But the United States government has decided that as long as the vaccine is 50% effective, meaning that it reduces your chances of getting the virus by 50% at least, that is good enough for a vaccine if it's going to be mass distributed to the American population. But there are reports that the Pfizer vaccine has around a 95% effectiveness rate, which is absolutely amazing. That means that out of 20 people who take that vaccine, 19 of them will actually be immune from the virus. Getting to 100% is nearly impossible, but if 95% of the people who take that vaccine don't get the virus, they're immune to getting the virus, then that is absolutely spectacular. Not only does the Pfizer vaccine have that high of an effectiveness rate, so does the Moderna vaccine. The Moderna vaccine has already been shown to have around a 94.5% effectiveness rate, at least in its early trials. So that is really amazing, the fact that we have two vaccines that have an effectiveness rate above 90%, which means that if you take either of those vaccines, you have less than a 10% chance of actually not being immune to the virus. Like I said, getting to 100% is nearly impossible, but if we have a 95% effectiveness rate, that's still pretty amazing because that means that if everybody in the country takes the vaccine, only 5% of those people can even get the virus in the first place, and that is way over the threshold for herd immunity. It is unknown what the exact threshold is for herd immunity for this virus. It could be anywhere from 50% to 90%. That's a pretty big range, but the fact that these two vaccines have both been shown to have above a 90% effectiveness rate for this virus, that is definitely a really good thing. Now, once again, before this vaccine comes along, we're gonna have to do other things to stop the spread of this virus. And like I said, one of them is mask, but there's also a few other things that can be done to stop the spread of this virus. First of all, I think that mask mandates should definitely be put into place whenever possible. Basically, whenever possible, a business should be required to make its customers wear masks because that will really stop the virus from spreading if everybody actually wears the mask. Problem is that a lot of people don't wear the mask even when they're able to because for one, they might think that it's uncomfortable, or for two, they might just think that it bothers their face, or even they might say that they can't breathe, but I don't think that's a very good excuse to not wear a mask because it has been shown that masks don't really impede your ability to breathe effectively. I can understand that it's really hot outside and you're going for like a jog or something that you might not feel comfortable wearing the mask, but first of all, it's getting pretty cold outside. And second of all, if you are jogging, you should not be near anybody else. You should be socially distancing if you're not wearing the mask. And that brings me to my next point. Whenever you're not able to wear a mask, you should be able to socially distance from other people. Whenever you're not wearing a mask, you should always remain at least 6 feet from anyone else. Preferably, you would remain at least 10 feet from other people, but it's recommended that if you're not wearing a mask or if other people aren't wearing a mask, you stay at least 6 feet away from them. 10 feet to be extra safe, but 6 feet's the absolute minimum. Because that way it's a lot harder for the virus to spread from person to person if you're that many feet apart. Indoors, it's easier to spread the virus than outdoors, so that's why it's recommended 10 feet indoors because indoors it's easier for the virus to spread from person to person. So, to be extra safe, if you're meeting up with other people and you're meeting up indoors, stay 10 feet away from the other people. But if you're outdoors, 6 feet should be fine. Now, in terms of shutdowns, I don't really think that many businesses need to be shut down. The majority of businesses can implement mask mandates. The majority of businesses can still run even if the people wear masks. I guess there are a few exceptions to that. For one, bars won't really be able to have people wear their mask because unless you just like go there to meet up, but if you're gonna get a drink, then you can't really have the alcoholic drink without actually putting the mask on. So I guess bars are one of the businesses that can't really do a mask mandate. I guess bars would need to be shut down temporarily, but besides that, many other businesses can remain open. In terms of restaurants, I guess restaurants could switch to takeout, and instead of having dine-ins, they could just do takeout instead. But if they're going to do dine in, or even if you're going to a bar, I would suggest that these businesses should make it so that there are either physical barriers between each table, or the tables are socially distanced, or both. And if you're going to a bar, I would suggest that the tables, or wherever you sit at, all those different stations should be socially distanced, preferably 10 feet apart, but at least 6 feet apart. And one more thing that could be done to stop the spread of this virus, and this is more of an economic thing than a health thing, really, but I would suggest that the federal government should give out its citizens several $100s a month or even $1,000 a month until this pandemic ends. I guess $1,000 a month would be a good amount, or even $1,200 every single month. In the first stimulus bill that was passed earlier this year, there was a one-time payment of $1,200 that was passed, that was given to certain people who are below a certain income level. But I would suggest that now they give that to everybody and they do it once a month. And in that first stimulus package, they also passed a bill saying that anybody who is unemployed would get $600 per week until the end of July, but that expired long ago. They were supposed to pass another stimulus package before then, but it kept on getting delayed and delayed and delayed. But I think that $1,000 a month or $1,200 a month, one of those two numbers, I don't know exactly which one is better, but I think that would really be a good idea to pass because that would make it so that people who lost their job because of this pandemic or people who can't work because it's too dangerous for them to work, they will still be able to support themselves, support their family. They will still be able to have a place to live. They will still be able to make all their payments that they need to make. This pandemic is nobody's fault. Nobody wanted this to happen. Nobody is at fault for this pandemic taking place, but people still are suffering the economic consequences of this. And I think that passing a universal basic income for the duration of this pandemic would really alleviate the effects of this pandemic, the economic effects. This was actually Andrew Yang's policy proposal in the primaries, but I think that for this specific pandemic, it would be a good thing to pass until this pandemic ends. That way, because not only will people be able to support themselves financially, but they will also spread the virus less because they won't feel like it's necessary to find a job that could potentially put them in danger for getting this virus.